This Giovanno video is going to walk you through how you'll be using your system to create patients, create claims, copy claims, and also how to use calls and to-dos and view reports. First of all, you will enter your username and password on the login screen and select Login. This is the page that your system will automatically default to when you log in. You'll have a 2-day calendar, the Manitoba Health section, and on the right-hand side, calls and to-dos. On the top right-hand corner of your page, your name will appear with a down arrow. This is where you can select your own profile, make any edits that you may need to under the name, salutation, anything that you feel you need to edit here. And you can go to the Login tab, and this is where you can change your username and password and save and exit to get back to the home page. If you would like to create a new patient, you can go to the Patient tab and select New Patient, or you could click on Patients, New Patient, or from the New Claim button, you can click the down arrow at the end of the patient name field and select New. This is a quick patient creation pop-up where you can enter in as much information as you can because the information will be required for the claim. Once you've entered in all the patient information and saved, you will then be able to quickly create a claim for that patient. So now let's just create a claim. I'm going to start typing in the patient name, and I have the options to select. The patient details will automatically populate. The appointment details, the practitioner name will automatically default when you're logged in. We'll put the appointment date, March 25th. On the right-hand side under the claim details, the claim will populate Manitoba Health and the invoice date. You can edit if required. You could start typing in a referred by practitioner if you've entered these into the system, a radiologist if required, a hospital if required, and under the type you'll have these options to select from. The location of Winnipeg will default, and you can type in custom content about the comments for this particular claim if required. The start date will be the 25th, and the end date was the same date. Some tariffs require a time, which you can enter in. For this example, I am going to use tariff number 78513. I start typing the tariff, and then I can select it from the items. If I wasn't sure what the item was, I could click the Go button and search, and I'll get a pop-up that will allow me to search for tariffs that are uploaded into Giovanno. And then all I would do would be to click on the item number, and it will automatically populate into the tariff field. As you can see, the base fee has already populated. I will now click Add, and the item moves over to the left-hand side of the page, including the tariff. Now I'm going to add another tariff number. And again, I'm just going to add. And now I'm going to add an ICD code that is related to these two appointments. And now I've got two tariffs. I've got my ICD code in here, and now I can simply save. The claim is created in the background, and I go to the next blank claim form where I can continue to create claims. Now let's say, for example, I wanted to copy the last claim that I just created from that patient. In the patient name, I can type in the patient name, select it from the drop-down options, and now I can go to copy previous claim, and it will automatically populate the last claim details. And you can edit these. You can remove them by selecting the red X if needed and create another claim. So now that you've created the claims, you will have access to reports. Now for the payments by practitioner, We haven't actually parsed any remittances, so there won't be any, but you could just click on Payments by Practitioner to see the report. You can do a start and end date. You can do a PDF or Excel. Under the Rejections and Abnormal Payments, again, you can do a start and end date and do a detailed or summary version and create the report. We are able to do the Sales by Practitioner, and we can select a start and end date, and I will just do a PDF for this example. But now what you will see is a PDF of the claims that we've already created. This is the PDF with all of the details for the invoice date, appointment date, the claim number, the patient, any referral if there was one, and whether it was paid or not. Now I'm back on the home page, and that is all that you really need to know to get going and get started on billing some claims and creating claims. Over here on the right-hand side of the page, we've got calls and to-dos. You can click on the add icon and you can select whether it's a call, to-do, an appointment, or a meeting. I could put a title in here, Call Patient After Surgery. I could put the patient's name in here. I could put the date that I want to perform the action, the time that I want to call my patient, and also I could set up an alert that will pop up on my schedule and remind me that I have to make this call at this time for this patient. I can also put a custom memo in here and save. For this example, I'm not actually going to save it, but if I did, it would appear listed under calls and to-dos. You're able to add a note, complete the item, dismiss the item, and view the history. And any call or to-do that you enter in the system will also save in the patient's profile under the Communication tab.